post-traumatic stress disorder. So, the clinical features of PTSD, the hallmark symptom is that there should be definitely an exposure to an actual or threatened stressor, followed by indicative emotional and behavioral symptoms. The stressor can be anything like that of armed robbery or personal assault or serious motor vehicle accident. The traumatic event is re experienced through flashbacks, just like how they show in the movies, dreams, or even exposure to stimuli that are associated with the event. The behavioral symptoms include increased states of arousal like hypervigilance, irritability, startled reactions, difficulty concentrating, sleep difficulties. There can also be avoidance of people and activities associated with the traumatic event. This is also characteristic of anxiety disorder where there is almost always an avoidance behavior. The DSM 5 diagnostic criteria of post traumatic stress disorder includes exposure to actual or threatened death, serious injury, or sexual violence in one or more of the following ways. It could have been something that was directly experienced, witnessed, or learnt that it has occurred to a close family member, and also there could be repeated experiencing or extreme exposure to other details of the traumatic event. Next is there should be presence of one or more of the following intrusion symptoms associated with the traumatic events like recurrent involuntary and intrusive distressing memories, recurrent distressing dreams, dissociative reactions, to call it simply flashbacks, intense or prolonged psychological distress at exposure to cues. The cues can be internal or external. There can be marked psychological reactions to cues. The other criteria includes persistent avoidance of stimuli associated with a traumatic event, and also there can be, most importantly, negative alterations in cognitions and mood associated with a traumatic event. It can present as inability to remember the event, or there can be persistent and exaggerated negative beliefs or expectations of oneself or others, or they can even be persistent distorted cognitions about the cause or consequences of the event. There can be persistent negative emotional state or even marked diminished interest, or there can be feelings of detachment, even persistent inability to experience positive emotions. Anhedonia can also be present. And there can be marked alterations in arousal and reactivity that is associated with the traumatic event, as characterized by there can be irritable behavior and angry outburst upon memory or upon recent trigger surrounding the situation. There can be recklessness or self-destructive behavior, hypervigilance, exaggerated startle response, problems with concentration, and sleep disturbance may also occur. Next is the duration should be present for at least 1 month, and there should be clinically significant distress or impairment, and all these symptoms should not be attributable to the physiological effects of a substance. Just like any other disorder, treatment of PTSD also involves pharmacological and non-pharmacological modalities. However, here in PTSD, non-pharmacological modalities have a upper hand. So we can think of using oral propranolol to reduce autonomic arousal. SSRI and other antidepressants can be used. And like said before, cognitive behavioral therapy, group therapy from the same class of workers should be used.